You're listening to The Social Workers on WCDB Albany.
Welcome back. You are listening to WCDB Albany, and this is The Social Workers live radio talk show. My name is Eric Hardiman, and I'm here with my co-host, Alyssa Lotmore. Welcome back, Alyssa.
Hey, Eric. We have a great segment today with a guest that we're both familiar with.
A repeat guest. It's always nice to have guests back. And so today we have a great episode lined up for you. We have a conversation with Dr. Lynn Warner. Lynn Warner is professor and dean of the School of Social Welfare here at the University at Albany. She is entering her third year as dean at the school, but has been on the faculty at the School of Social Welfare for more than 10 years. During that time, she has taught in the MSW and PhD programs and collaborated with faculty and staff in many administrative roles, including as director of the MSW program and associate dean for research. Her own research focuses on disparities in the delivery of mental and behavioral health services, especially disparities which are experienced by groups who are vulnerable because of low income status or age and who are racial or ethnic minorities. She is helping lead the team at UAlbany that was commissioned by New York Governor Andrew Cuomo to inform the state about the differential impacts of COVID-19 in minority communities and how to mitigate those disparities. She has also published more than 60 peer-reviewed journal articles and book chapters, and her research has been supported by more than $1 million in national foundation and federal government grants. One of her current projects, funded by the Robert Wood Johnson Foundation Interdisciplinary Research Leaders Initiative, focuses on how behavioral health service providers in rural New York are adapting to significant changes in the way Medicaid managed care reimburses for their services. Dean Warner is proud to be a first-generation college graduate who earned a Master of Public Policy degree from the Kennedy School of Government at Harvard University and MSW and PhD degrees in sociology and social work, both from the University of Michigan. Dean Warner, welcome back to the Social Workers.
So happy to be here, Eric and Alyssa. I don't know if it's relevant to the listeners, but we're three of us on Zoom, which is where we tend to connect most these days. So happy to see you and happy to be here as always.
We're making good use of the Zoom technology during this particular era. Absolutely. So we're excited to have you back on the show and to talk about everything that's going on at the School of Social Welfare. We imagine and certainly hear about the impact of COVID on the community, on the university, but we'd particularly like to ask you sort of about how things are going at the School of Social Welfare, if you could update our listeners.
Sure, I'd be happy to. There's probably not going to be a lot of surprise among the listeners to hear that we have actually almost, I wouldn't say completely, reshaped and redesigned social work education because of COVID, but we certainly are in the process of adapting and responding just like the rest of the world is. And so I'm glad to have a couple of minutes to kind of give you an overview of some of the major changes that have been underway. So, kind of as a quick reminder, last semester, in March, when the COVID was beginning to take hold, and the university, like all universities around the country, decided it was most important to protect health and safety of students, faculty, and staff by pivoting to completely online courses. We were immediately faced with the question of, well, what does that mean for social work education when we have students whose courses are completed by doing internships with community agencies? So, luckily, the timing of the pandemic then was such that the required hours that students had to complete were well underway. So any kind of modifications that we had to do in terms of working very closely with our community partners to identify if there were opportunities for tele-social work, we quickly identified those opportunities. And for those agencies that maybe were not yet equipped to be able to deliver services to their clients with that modality. We were creative in coming up with some local assignments here. And now that we are well into the fall semester, and unfortunately the pandemic is continuing to require us to be very creative in the ways that we think about not only partnering with the agencies that provide the placement opportunities for our students, but many other ways that we can educate social workers around the competencies that they're expected to develop to be professional social workers. So I guess one thing that everyone should remember is we still are working very closely with all our partner agencies. And so that means, like we always have, we have maybe, at least this year, we have probably around 300 students who are doing field work. Most of those students are actually doing that work in what we would consider traditional agency-based field placements. We're doing that work with a whole host of organizations, ranging from small grassroots organizations like the Refugee Welcome Center, up through large hospital corporations like Ellis, Albany Med, St. Peter's, and everything in between. We place students in agencies as far north as Plattsburgh, east into Vermont, south to Westchester, and west to Syracuse. A lot of the practice that we call clinical practice, that would be individual interventions with individuals or families or small groups, is happening with populations who are facing all of the COVID-related disruptions that are so prevalent, related to the issues around caring for aging and frail individuals who can't leave their homes and who maybe need to be isolated, and how to make sure that they have continued social connections. We have students placed in schools. We know that the school systems are so challenged to continue to provide not only the education, but the other wraparound supports that students need to be successful. So we have many students placed in school systems. We also have a lot of what we would call macro placements, and those are students who are placed either with advocacy organizations, such as the Alzheimer's Association or the American Cancer Society, and also with government organizations. We have placements at the Office of Alcoholism and Substance Abuse Services, the Office of Mental Health. And this year we even have students placed with Senator Julia Salazar and Jennifer Metzger's office. So, and just to give a little more detail about what those agency-based placements are like. So just some examples. We have students who are assisting with contact tracing, supportive aftercare. They're staffing hotlines for assault victims, those who are in mental health crisis. As I mentioned, supporting the elderly in skilled nursing facilities, working with incarcerated individuals, and again, working through the public school system. Now, some of the ways that we have been creative, that have been, required of us to be creative, not just because we're so thrilled to have more students entering the MSW program this year than we have in the past. So we have to find more placements and make those placements possible. But we also know that locally here at the University at Albany, there have been increasing needs that the student population here is experiencing. And so we've worked with various entities and units across campus to develop internships for our MSW students so that they can do the work that is needed for either academic recovery programs, the intercultural student engagement program, the listeners may know that the university itself has its own contact tracing student support team, which is a really important place where our students are having interprofessional opportunities with students at public health and psychology to support the students who are either wondering what to do if they believe that they've been exposed, and then for those students who've been unfortunately quarantined. So
doesn't seem to be a shortage of opportunities for the social work students and the social work community during this time. I think that's one of the things that this pandemic has brought out is the need for the social work profession. And a lot of our past guests, we had one of our alums come on, Kevin O'Keefe, who is at Albany Medical Center as a medical social worker, come on, talk about the hospital, the medical social work experience during, COVID-19, especially at the height when patients were being brought up from New York City. It's just, this shows the need for the social work profession. Is there an option for sort of this virtual type of social work services too, maybe for students who can't be on campus or who, don't feel comfortable going into agencies? What are the opportunities for them at this time? Or are there opportunities?
Yeah, absolutely. That's a great question. And so it's a mixture in terms of whether or not the existing agencies that where students are placed themselves have the opportunity for the students to work remotely. So if an entity has the equipment and has the part of their service delivery mode itself, it includes teledelivery, then our students absolutely have that opportunity with them.
Great.
For those students who, for whom we haven't, there isn't an agency-based placement, we are creating this year content area foci for students, and this is primarily for our first year students who are just beginning to learn about the social work profession and who need to gain a broad range of experience and exposure to all kinds of generalist practice. They are working closely with a team lead who may be a field educator or a faculty member to design and implement their own field experiences. And I think this is a very, very creative way of doing field education that we're excited about it, but it's one of those activities that really resonates with anyone who hears that phrase, you're building a plane as you're flying it. So it's exciting, but it's also going to be a learning curve and learning opportunity for all of us.
No, I have to ask. I mean, as you said, this is sort of, we're learning as we go. But are some of these things, do you think, even, and after this is hopefully not a pandemic for too long of a time, but are there things that you think the school will adopt in terms of keeping some of these practices in place? Because there seems to be, types of virtual work that students might be doing that are really engaging with community members, still getting their core competencies in. Are there things that we're learning now that we might say, hey, we would like to keep this because it might be a good method for learning in the future?
Yeah. So that question really raises the importance of acknowledging that because we are a profession that is, so we're a profession that is obligated to be responsive to and regulated by the professional social work education, the State Board of Education, the State Office of the Professions on the one hand, and also the Council on Social Work Education, which accredits our school and all other schools regarding whether or not those schools meet the standards of the profession in the way that they deliver their education. Many of these innovations have been approved on a waiver basis. And so as we learn our way through and can identify and demonstrate that, yes, indeed, students are learning as well as effectively as ever with these new ways of doing business, then I believe once the pandemic's over, and once education and the profession goes back to normal, we will have learned that there are a lot of ways that we can provide this education. So it's not an easy answer, because it requires the whole many organizations to agree on how best to educate our students. And I'm just so, which sort of reinforces for me why we're so lucky to be at the University at Albany, where the faculty and staff are committed to not only providing this education, but to do it in a way that is assessing how it can be done as effectively as possible as we go. So I think that's a really important component of this. We're not just winging it.
So it strikes me when listening to you, Lynn, that the social work profession itself has a long history of being responsive in times of crisis, in times of disaster, in times of greater public need. And so sort of thinking about some of that history, I start to reflect a bit on what it might be like to be a graduate student entering a profession like social work at this particular historic moment, when we have a pandemic, when we have social unrest and upheaval, and we have just so much going on in this country that's very overwhelming. And yet we have a large number of students willing to, drop everything else in their lives essentially and come to graduate school in order to be trained to become helpers and to join a profession that is about creating change and hopefully helping us move toward a more just society. So I guess I'm just wondering, from a potential student perspective, do you have any thoughts about what that might be like to be a student at this time, and even for prospective students that might be listening? Why would they choose to come to a social work program in a time like this?
Yeah, before I answer that, I think I have to first say I'm every day inspired by the students who are here right now who have made that decision to pursue this education at a time when it's a destabilized time, and so it requires everyone to approach their work, their education in a way that is open to being flexible, but is also focused on the purpose and the mission of why are you doing this? Mm-hmm. And I think that is for those individuals who see the need and who recognize that all of our institutions have a long way to go for us to be, for the United States, for Albany, for all of our communities, to be the kinds of places where everyone has the best opportunity possible to live their fullest lives. There's so much need for all of our systems to function better, and that's exactly the role that social workers play. They identify gaps, they assess needs, they identify opportunities, they creatively broker for people to have access, and they advocate for systems to change. So if any of those things those words that I just said are what motivate people to get up in the morning, then social work is absolutely the place where they should be spending their time, and where we need them to come join us. There's no other profession, from my perspective, that that allows people to draw on both their talents and their skills, but also their passion to pursue a job that really makes a difference and is fulfilling. So
yeah,
that's my pitch.
I think we can all agree with you on that.
Yeah.
No,
You also, or go ahead.
Go ahead,
Alyssa.
Eric.
Yeah. You also mentioned earlier, you mentioned faculty and staff at the school. Can you talk a little bit about maybe some faculty initiatives? Are there faculty projects related to COVID, related to the current times and what's going on? Are there, new projects happening that maybe you want to share with the listening audience?
Yeah, it's really been interesting to think about that and to revisit all of the faculty's research projects with this COVID lens, because it really is a reminder that, we talk a lot about in social work about person and environment, mm-hmm. and the interconnection between systems. And so while COVID has certainly done nothing but remind us of how everyone's research interests, whether it was sort of health related or not, has a direct connection to how society is functioning in COVID times. So those faculty members who, for example, have been studying and working with children, and maybe children who are in foster care, the implications for families around providing resources for their kids, and maybe even the reality that all of the court systems have slowed to almost a screeching halt, so that family court cases have been backed up. So there are just so many cascading influences of COVID, so that every individual faculty member's research, whether they wanted to or not, or even directly address COVID, continue to be really relevant. Having said that, we also have several. We have a couple of initiatives related to the implications of COVID for immigrant and refugee populations, and whether it's both access to healthcare services and also the implications of the disruptions to sort of the service industry, where many immigrants and refugees might work, and so the economic implications for them. And so we have faculty who are examining that and hoping to identify the interventions that could prevent further further detrimental consequences for those populations. And I think, that one small example just again underscores that whatever the social work agenda is, the eyes are always focused on those who are least likely to have access to resources, and or those who are most likely to be disenfranchised. And so the other companion to COVID is, as you mentioned, this really serious civil unrest and the issues that have been raised around Black Lives Matter by Black Lives Matter, yeah. And the increasing calls for racial justice and much more direct action focused on advancing racial justice agendas. And we certainly have several faculty whose not only their research agendas, but their service obligations. They're volunteering in the community to be part of boards and initiatives focused on that. For example, the Albany mayor has called for a panel to attend to highlight the voices of the community in Albany and what their goals are for police reform, which include our faculty member Robert Miller on that, as well as faculty from other units across the university. So those are just a couple.
Yeah.
And for our listeners who might want to find out a little bit more and hear more about this, there have been several faculty members who have been on the show recently to discuss the areas of work. For example, Dr. Mary McCarthy and Dr. Kate Lawrence came on to talk about their work with the National Child Welfare Workforce Institute and how COVID-19 has impacted that community. We had Dr. Sarah Mounts come on and talk about the impact on foster care students in the university. So there's a lot of information on our previous podcasts as well, and we are hoping to continue to interview faculty as guests on this show to get that message out to our listeners about what's going on and how they are making an impact in the Albany community and beyond.
It sounds like an exciting time in some ways. I mean, I hear a lot of conversation about stress, anxiety and worry, just writ large in the community right now. But at the same time, I think what I'm hearing in some of your words, Lynn, is also an opportunity to think differently and to push for change. And, whether that be in the Black Lives Matter arena and social justice and anti-racism efforts, whether that be in higher education and sort of furthering the idea of a university that is community engaged and that plays a significant role in the community, in bettering that community. It sounds like amidst all of the difficulties and challenges, you're also seeing this as a time of opportunity and change.
Absolutely, and I appreciate the contextual observation, though, that it is a time of anxiety and stress for many. And so I don't want to underestimate that as we are doing this work, it's also really important for us to be very attentive to what it takes to professionally, for the profession and for the individuals in that profession, the current students, the faculty, and our alum who I hope are listening, that the work is hard. And it's a hard time to do this work, and that there are also, it's been heartening to see the increasing opportunities for reflection and collaboration around just what it is like to try to be the change agents that the profession calls for at a time when we know everyone's lives are also equally stressed by the realities of COVID. So it's got to be part of the 3-point stool. Whatever leg of the stool, one of those legs has to be caring for each other and caring for self. So it's an important reminder.
It's interesting that you mentioned alumni too. I get the sense that for the School of Social Welfare, it's important to connect to its alumni base. Maybe not always in the traditional ways of asking for resources of the alumni base, but in terms of engagement and in terms of connection with the social work profession and with the School of Social Welfare. That, Alyssa and I love having alumni from the school and from the university at large on our show, just because it shows that the relationship that folks have with the University of Albany does not end upon graduation, that relationship can go forward over time and really involve some exciting opportunities for engagement and connection.
Yeah, absolutely. And, our alum are, I'm not biased at all when I say this. I think that they're just they're a special group because their commitment is as alum, but it's also as part of the profession. Mm-hmm. And so our students look to our alum not only for inspiration, but they inevitably, so many of our alumni are working in the agencies in the region who are providing supervision for our MSW and undergraduate interns. So our educational apparatus could not exist without our alum.
Right.
And they're such an integral part when they do become field instructors for us of that pipeline. And then whether or not they're field instructors, they are in the settings where our students work, and they are helping cultivate and reminding the important role that social workers play in all these organizations.
Great. Any other questions, Alyssa?
No, I just want to say thank you because having you lead the school during this whole time has been as smooth as possible for us as employees. And I want to thank you for your leadership and all the work that you've been doing. I know we haven't always been on campus as much, but every time I drive by, I do see your car. So I know you're always working. And I want to thank you because the amount of work and time that you are committing to make sure that the students and the employees have the best experience that we possibly can during this time, and a safe experience. I really do appreciate it. And I think Eric agrees with me on that.
Absolutely. I think leadership in a time like this is an essential ingredient to any school's success. And your leadership is really wonderful and shows everybody else how to act, and how not to get overwhelmed, and how really to push forward during difficult times.
Well, if the viewers could see, I have tears in my eyes because it's just so inspiring to be with you. And I have to say, the radio show has been, one of the sort of a steady component of the school for so long, and it's been such a nice reservoir for so many of our community members to be able to have that connection to both the university and the school. So thank you both for continuing to carry that microphone.
And we that's probably a good time to wrap up here, and also make an urge to listeners. If you are out there listening to the Social Workers Show frequently and you'd like to be a guest, if you have work that you'd like to share with us, if you have a new project or ideas that you'd like to discuss with us, please feel free to reach out to Alyssa and I. And maybe Alyssa, you could give some contact information, but we love having community guests on the show. We love having alumni, social workers, policymakers, community members. We're really open to expanding the conversation because we think it's important.
And if you are an alum who wants to be on our email list in terms of getting the e-news from the School of Social Welfare and you're not yet on it, you can also email me and I will make sure that you are on that list. So my email is alotmore@albany.edu. So please contact me and let me know how we can, like I said, Eric said, best assist, whether it's being on the show, subscribing to our e-news, and getting updates from the school where we want to be connected.
And if for some reason you've just tuned into the show, you're listening to the Social Workers. I'm Eric Hardiman, and I'm here with Alyssa Lotmore, and we've been interviewing Dr. Lynn Warner, who is professor in the School of Social Welfare and Dean of the School of Social Welfare at the University of Albany. Lynn, we'd like to thank you so much for being our guest again, and extend an ongoing invitation. Anytime you'd like to come back on the show, you're always welcome.
Sounds great. Take care. Thank you.
Thanks for listening to WCDB. We'll be back with more of the Social Workers next week.
You're listening to The Social Workers on WCDB Albany.